Hi, I'm Dr. Ferguson with the Stem Cell Pro, and if you're watching this video, it's because you've been in communication with Renee, who helps me get people on my schedule, helps get them signed up for seminars, and you probably have some questions. And so I wanted to keep this short and sweet, to be very honest. Don't want to make it too long, but I wanted to give you as much detail as we can to help you understand a little bit more about stem cells. So I get the same questions asked over and over and over. And so what I'm going to go through with you today is the top 5 questions that people ask when we get on the phone. So the first one, and I'm not going to read, but I got a couple little notes here. I want to make sure I don't miss anything. But they always ask, where do the stem cells come from? So that's pretty easy, pretty simple. We get our stem cells from the umbilical cord after a C-section birth. So mom's healthy, baby's healthy. They go home to live their lives like normal. And the umbilical cord is shipped to a lab where all the stem cells are harvested from the umbilical cord. So there's other ways you can get it. You can get it from your own body. Everyone has stem cells. The problem is, the older we get, the less potent, the less viable those stem cells are. And I always say, you're robbing Peter to pay Paul. So I don't want my old stem cells. I want the freshest, newest ones that come from the umbilical cord. The second question everyone asks is, how many stem cells are in these treatments? And so what you have to understand is, a stem cell treatment across the country, they always talk about cc's, so how many cubic centimeters there are, which is a very small amount of fluid. Picture a centimeter cubed, cubic centimeter. Most clinics will do 1 or 2 cc's. We have done 4 cc's for about the last 3 years with most treatments. So we really do about double, sometimes even 4 times as much as other clinics, which gets us better results, more consistent results. And that's one of the reasons why we do that. Is one treatment enough is another question. The answer to that is usually it is. Okay, so if I treat 10 people, I'll tell you we have a success rate across the board with most conditions of about 90%. If I treat 10 people, 9 of them, it's like miracle results. They're super happy. They love me. They think this is the greatest treatment on the planet. And unfortunately, I'd rather be upfront and let you know, about 1 out of 10 will say, well, Dr. Ferguson, I feel a little better, but it wasn't worth the money. That's usually what they'll say. When that happens, I'll tell you, I don't like it. It does happen. 10%, it just doesn't work as well as we were hoping for. I recommend doing a follow-up treatment. That follow-up treatment is a big discount, and we'll go over costs in just a little bit. So by the time we're done with this video, you'll know exactly what the prices are. But usually 1 is enough. Every once in a while I get 2 treatments to take care of it. We do a lot of chronic diseases, autoimmune diseases, digestive disorders, brain issues, and sometimes we'll recommend up to 3 treatments. It just depends on the situation. But for most people, just 1. Does insurance cover it? That's probably the number one thing people ask. Unfortunately, no, insurance doesn't cover it. This is a self-pay or cash pay clinic across the board throughout the whole country. If you're going to do a stem cell treatment, it's not going to be covered by insurance. We've been doing these treatments for 10 years, since January 2015. And I've told people from that time forward that don't hold your breath. I don't know if it will ever be covered by insurance. And the products that we have today, it's just something, if you're going to move forward, you got to decide, is it worth it for you to pay for it? So that brings me to the last point, is cost. A lot of people call me up and they expect it to be expensive, and it is expensive. It really is, but it's getting better. So when we started these treatments over 10 years ago, they were much more expensive than they are today. So for 1 treatment today, it's $3,900. Okay, $3,900. If you're one of those 10% of people that need a follow-up treatment, we do it at an extreme discount, and it's $1,000 for that follow-up treatment. And there's a couple things I'll tell you. The follow-up needs to be on the same area. We're not going to do a right or a left shoulder, and then next time you come in for your discount follow-up, we're going to switch and do the other side. It's got to be the same shoulder. We have to do a first treatment to get a follow-up price, right? And then we have to do the same area. So it needs to be at least 3 months down the road. Typically, there's some few exceptions, but typically we want to give it enough time to work. So that's typically the vast majority of the questions people want to know on a first phone call. However, I still recommend you consider calling us up. The number's on the screen, 480 331-1745. Call me anytime. We can set up a phone consult where I can get a little bit more personal, a little bit more specific about what you're dealing with, and we can go over, all the questions you have and all the options that are available at my clinic. I look forward to helping you learn a little bit more about stem cell therapy and how it can get you feeling the way that you want.